Welcome to our deep dive, and today we're tackling something you may not have heard of.
Yeah, this is something that goes beyond the usual advice, to cut back on processed foods. It really delves into how those foods can impact your brain long term.
Right, and we're going to be basing this deep dive on the work of Dr. Bill Wilson. He's the one who kind of coined the term.
And what's really intriguing is it's not just about weight. We often hear about the link between processed foods and obesity.
Right.
But CARB syndrome, it can affect anyone, regardless of their size.
That's what caught my eye, too, when I was doing the research for this. It's like, we're not just talking about, feeling a little sluggish after you eat a donut. This is about potentially serious and long-term effects on mood, focus, even things like impulse control.
A really powerful example of this is the late Anthony Bourdain. He struggled with cravings, mood swings, impulsive behavior. He's very open about it. And Dr. Wilson suggests that these struggles actually align with the CARB syndrome model.
Wow. That's really powerful. So, okay, let's get into the details here. What are the signs? How do you know if this is something that you should be paying attention to? Especially since, you mentioned earlier that a lot of doctors aren't even familiar with this yet.
Yeah, that's the tricky part. Dr. Wilson, he's identified 22 key symptoms, but a big red flag, like a really strong indicator, is having strong, persistent cravings, specifically for sweet and starchy foods.
Right. That makes sense because that's kind of the fuel that's driving the whole cycle.
Right, exactly. Like if you're constantly battling those intense cravings, it could be a sign that your brain isn't getting the stable fuel it needs.
Okay. So, what if you don't have intense cravings? Are there other symptoms that might point to this?
Absolutely. Things like brain fog, difficulty concentrating, mood swings, irritability, anxiety, even sleep disturbances. All of those can be part of the picture. And it's not just how you feel. There's what we call metabolic component to this as well.
Okay, so what do you mean by that? What's the metabolic component?
So even if you're not overweight, things like your body composition, your fasting glucose levels, even markers of inflammation, those can provide clues about how your body's processing all those sugary processed foods.
Oh, interesting.
So, for example, if your fasting glucose is consistently on the high side, that could be a sign that your body's struggling to regulate blood sugar, even if you don't look like you have a weight problem.
So it's really about getting a better understanding of your overall metabolic health, not just focusing on the number on the scale.
Exactly. It's connecting the dots, like what you're eating, how your body's responding metabolically, and then ultimately how your brain is functioning.
So now let's say someone's listening to this and they're thinking, maybe this is me. What's the next step? Where do they go from here?
Well, this is where Dr. Wilson's 6 pillars of treatment come in. It's a pretty comprehensive approach, addresses CARB syndrome from a lot of different angles. We're talking diet, medication, supplements, exercise, sleep, even the role of relationships in supporting brain health.
It's like a whole life approach. Okay, so let's start with the foundation. Diet.
He emphasizes eliminating what are called high glycemic carbohydrates, primarily found in grains and processed foods. So basically saying goodbye to those sugary, starchy foods that are driving this whole CARB syndrome cycle.
So I'm hearing cut the junk, which, on the surface makes sense. But what about, we were talking about those intense cravings? That's got to be tough, especially in the beginning.
Yeah, that is a big hurdle for a lot of people. And this is where things like medication and supplements can come in. Dr. Wilson sometimes uses medication strategically, especially in cases with really severe symptoms.
Okay, hold on. Medication. Tell me more about that.
Yeah, so the medications he uses, they primarily influence neurotransmitters, things like dopamine, serotonin. And these are basically the chemical messengers in your brain that affect mood, motivation, things like that.
Right.
So by carefully using medications that target these neurotransmitters, he's essentially helping to what he calls jumpstart the brain.
Oh, interesting.
And make it a little easier for patients to stick with those healthy lifestyle changes.
So it's not about long-term reliance on medication, but more about getting the brain kind of a boost while you're making those initial changes.
Exactly. Once the brain is functioning a little better, the reliance on medication, it often decreases.
Okay. So in addition to medication, you mentioned supplements. What kind of supplements are we talking about here, and how do they fit into the bigger picture of CARB syndrome?
He focuses on what are called neurotransmitter precursors.
Okay.
So these are essentially the building blocks that your brain needs to produce those essential neurotransmitters, like that dopamine, serotonin we were talking about.
So it's like giving your brain the raw materials it needs to function at its best.
Exactly. And he's actually developed a A specific product called CRB22 that contains a blend of these precursors. It's specifically designed to support those key neurotransmitters.
Okay, this is all starting to come together, but I got to ask, like, with all this talk about medication and supplements, where does, like, the good old-fashioned stuff, exercise and sleep, fit into this?
Oh, those are crucial too. Exercise, even moderate activity, it helps regulate blood sugar, improves what we call insulin sensitivity, which is really key for managing CRB syndrome.
Right.
And sleep. Sleep is when your brain does all of its repair and detoxification work. So when you're sleep deprived, your brain just doesn't function optimally.
There's not just what you eat, it's how you move and how you rest. Really, it's like a full, like, 360 approach.
Precisely.
And then you mentioned relationships. I'm really curious about this one because I think that's something that we don't always think about in the context of health.
Yeah, that's a good point. Dr. Wilson, he emphasizes the importance of social support, connection, in the healing process. He believes that strong relationships, they can help buffer stress, which often exacerbates a lot of these CARB syndrome symptoms.
So it's like you're creating this supportive environment for overall well-being.
Exactly. It's about addressing all aspects of a person's life that can impact their brain health.
That's a really compelling approach. But I'm guessing some people might be a little skeptical because, we haven't really heard a lot about CARB syndrome in mainstream medicine. And there's always, like, some hesitation around using medication for something like this.
I understand the skepticism, and Dr. Wilson acknowledges that there aren't a ton of large-scale studies on CARB syndrome yet. However, he's been treating patients with this model for over 40 years, and he's seeing positive results.
So he's basing his approach on, like, real-world experience, real-world observation, not just, like, textbook knowledge.
Yeah, and he's open to other approaches, but he hasn't found one that produces better results for his patients.
That's a pretty powerful statement. So for anyone listening who's, like, intrigued by this, what's the takeaway? Where should they go from here?
I encourage everyone to do their own research. Dr. Wilson has a website with tons of information about CRB syndrome. He's written a book on the topic as well. Don't just take our word for it. Explore the information for yourself and see if it resonates.
I love that. Empowering people to take control of their own health journey. And we'll be right back to explore those 6 pillars of treatment in more detail. So before the break, we were talking about those 6 pillars of treatment, and I really want to dig into the medication piece, because I think that might be a little surprising to some people.
Yeah, it's definitely not something you hear a lot about when it comes to, diet-related issues.
Right. So walk us through that. Like, how does medication fit into this approach?
Well, it's really important to stress that with Dr. Wilson, it's a very cautious approach. It's strategic. It's not about putting everybody on medication long term.
So give me an example. Let's say someone's struggling with really intense cravings and they just, like, they can't seem to break free from those sugary processed foods. How might medication help in that situation?
In those cases, he might consider a medication that helps boost dopamine levels in the brain because, dopamine, that's the pleasure, the reward neurotransmitter. And when you eat those processed foods, you get the surge of dopamine. And that's part of what reinforces that craving cycle.
Right. It's like your brain gets hijacked.
Exactly. So by using a medication that helps regulate dopamine, you can kind of dampen those cravings.
So it's not about masking the problem. It's about addressing the underlying, like, brain chemistry.
Right. It's about giving the brain the support it needs to break free.
Okay. But, I know some people are just, like, wary of taking medication, especially for something that feels, diet related. What would you say to those who are a little hesitant about this?
Oh, I totally get it. I mean, medication is a big decision, and it's not right for everybody.
Right.
And it's really important to emphasize that with Dr. Wilson's approach, medication's never a first-line approach. He always starts with those lifestyle changes.
Right. The diet, the exercise.
Exactly. But for some people, those changes alone aren't enough.
Especially if they're dealing with those really severe symptoms.
Right. So it's about finding, what works for the individual. There's no one-size-fits-all.
Right. And working with, of course, a healthcare provider who really understands this.
Absolutely. Someone who can really help you weigh those potential benefits and risks.
Okay. Good advice. So let's move on to supplements. We touched on neurotransmitter precursors earlier. Can you remind us what those are and why they're important for CARB syndrome?
Sure. So remember we were talking about neurotransmitters being those chemical messengers in the brain?
Yeah.
Well, neurotransmitter precursors, they're like the building blocks that your brain uses to make those neurotransmitters.
So they're like the raw ingredients?
Exactly. And Dr. Wilson really believes that supplementing with these precursors can be a really effective way to support brain health.
Okay. So walk us through some specific examples. What kind of supplements might he recommend?
He often starts with L-glutamine. It's an amino acid that can help reduce cravings and manage anxiety that often comes with them.
Oh, interesting.
Remember how we talked about GABA, that calming neurotransmitter?
Right. Yeah.
L-glutamine can actually help boost GABA production in the brain, so it can be really soothing.
It's like you're indirectly boosting those calming brain chemicals.
Exactly. Then there's omega-3 fatty acids. Those are crucial for just overall brain health.
Right. The omega-3s. Those are like the good guys that everyone should be getting more of.
Yeah, for sure.
But especially important for people with CARB syndrome because their brains are already dealing with so much inflammation and dysfunction, right?
Exactly. And he typically recommends a high-quality fish oil supplement that's rich in what we call EPA and DHA. Those are the specific types of omega-3s that are most beneficial for the brain.
Okay, so we've got L-glutamine for those cravings, omega-3s for just overall brain health. What else? What other supplements are we talking about here?
Another one he often recommends is L-theanine. This is an amino acid that's found in green tea. And it has this really unique ability to promote both relaxation and focus at the same time. So it can kind of calm the mind without making you drowsy, especially for people who are dealing with, both anxiety and brain fog, which he finds a lot of individuals with CARB syndrome experience.
Okay. This is all super fascinating, but I got to be honest, I'm starting to feel a little overwhelmed by all these supplements.
Yeah.
It's like, where do you even begin? How do you know which ones are right for you?
I hear you. It can definitely be overwhelming.
Yeah.
And that's why I always emphasize working with a knowledgeable healthcare practitioner.
Right. Someone who can kind of guide you through all of this.
Exactly. They can help you figure out, which supplements might be beneficial, what dosages are appropriate, and really importantly, make sure you're not taking anything that could interact with any medications you're on. And remembering that supplements are meant to complement, not replace, a healthy diet and lifestyle.
Right. They're like the supporting cast, but the main star is still those lifestyle choices.
I love that analogy.
Okay. So we've covered diet, medication, supplements. What about the other pillars? Exercise, sleep, and relationships. How do those fit into the treatment plan?
Yeah, so exercise is crucial for regulating blood sugar, improving insulin sensitivity, which you talked about earlier.
Right.
And when your body's better able to handle that glucose, your brain's going to function better too.
Yeah.
And you don't have to be, a marathon runner to see benefits.
Right. Just get moving.
Exactly. Walking, swimming, dancing.
Anything that gets you going.
Right. And then sleep. Sleep is all about giving your brain that downtime it needs to repair, recharge.
We all know how we feel when we don't get enough sleep.
Yeah, your brain just doesn't work as well.
Not at all.
And then finally, the relationships piece. This is one that, Dr. Wilson really believes in. He's found that stress can really exacerbate a lot of these CARB syndrome symptoms.
Well, yeah.
And having a strong support system can help people kind of manage that stress more effectively.
So again, it's about looking at the whole picture.
Exactly.
Not just focusing on the physical stuff, but like the mental, the emotional, the social aspects.
It's a holistic approach, really recognizes how interconnected everything is.
This has been so eye-opening. And I know we've touched on this a little bit, but I do want to kind of circle back to the fact that, there's not a ton of huge scientific studies out there about CARB syndrome. And I think some people might be wondering, okay, if there's not all this hard evidence, how can we be sure this is a real thing?
That's a really valid question. And as we said before, Dr. Wilson acknowledges those limitations. But he argues that, his 40-plus years of clinical experience, seeing countless patients who fit this pattern, who respond to this treatment approach, that's a powerful form of evidence too.
So it's about looking beyond just the studies and considering those real-world experiences.
Exactly. And, he's open to new research. He welcomes more studies to be done.
Right.
But in the meantime, he's not going to ignore what he's seeing in his practice.
Okay. So it's about being open to different forms of evidence, recognizing that, scientific understanding is always evolving.
For sure. And it's about, empowering individuals to kind of be their own health advocate.
I love that.
Seek out information from a variety of sources.
And that's a great segue into what we're going to explore next. This whole conversation about CARB syndrome has been really eye-opening. It really challenges a lot of the conventional thinking about diet and brain health.
Yeah, it's definitely a paradigm shift.
Yeah, it really is. It's not just about, eating less sugar. It's about understanding this whole interplay between food and brain chemistry and lifestyle.
Right, and it's acknowledging that what we eat, it doesn't just affect our waistlines. It really impacts how we think, how we feel, how we behave.
And for some people, that impact, I mean, can be huge, right? Can lead to all sorts of symptoms that maybe like get misdiagnosed or dismissed.
Exactly. And that brings us to, I think, some of the bigger picture implications of all of this. If CARB syndrome is as common as Dr. Wilson suggests, what does that mean for society as a whole?
Yeah, I mean, it raises a lot of questions about how we approach healthcare, right?
Yeah. I mean, traditionally, we've kind of treated mental health and physical health as separate things.
Right.
But CARB syndrome suggests, I think, a much deeper connection.
It's like instead of just looking at these little pieces of health, we need to start looking at the whole person
Right.
and understanding how all these systems are connected.
If we start recognizing those early warning signs and making changes to our diets and lifestyles early on, maybe we can prevent some of these conditions from developing in the first place.
I mean, that's huge. That suggests we have a lot more control over our health than we might realize.
Exactly. And this goes back to Dr. Wilson's emphasis on, patient empowerment. He really encourages his patients to educate themselves about CARB syndrome, advocate for their own well-being.
Right. It's about moving away from that passive model of healthcare,
Yeah.
where the doctor just tells you what to do, and moving towards a model where you're like an informed and empowered partner.
Right. Taking ownership, not being afraid to question things.
Now, we've been talking a lot about Dr. Wilson and his approach, but I do want to acknowledge that there are other viewpoints out there. Not everyone in the medical community agrees with him. And, we need more research in this area.
Absolutely. And it's always healthy to be skeptical, seek out information from different sources. And Dr. Wilson would even say that. He encourages people to do their own research.
So it's not about saying like he has all the answers, but more about just like opening up a new conversation.
Right. Expanding our understanding, challenging those old assumptions.
So where do we go from here?
Well, Dr. Wilson has a great website, detailed descriptions of those 22 symptoms, explanations of his treatment approach. There's even online quizzes you can take to kind of assess your own risk factors.
I think he also has a book, right?
Yes, he does. It's a really great resource if you want to dive deeper into this whole topic.
Awesome. Well, I love that, empowering people with knowledge, with tools to take control of their own health.
That's so important.
And I think that's a perfect note to end on. This deep dive has been incredibly insightful, I think. Definitely thought-provoking.
I agree.